Dr. Wishnie, explain a little bit this toenail fungus and, you know, how it comes about, and also lots of people, like at least in the past, is this kind of like stigma with it that you just really can't get rid of them. So what have there been any advances in podiatry? Is there any way to fix that stuff? Shed some light on it.
Yeah, toenail fungus, it's huge. I mean, we see lots of toenail fungus, and it has nothing to do with keeping your feet clean or not. Fungus in general comes from dark, moist, warm environments, so shoes right off the bat provide the proper environment for fungus. Other reasons could be trauma. Something dropped on the nail and the nail root has been damaged. The nail can't be produced with the new fungus nail. So there are a lot of reasons, and it used to be very, very difficult to treat. Now, with new technologies, it's not as difficult. The main new technology is a laser, and we have a laser in the office that helps treat nail fungus, and we do a combination of two things. One, we have a laser, which is about 7 to 10 minute treatment per foot, and it's painless. I mean, it's just a little warmth, a little heat, but it's painless. And then we put on a coat of something called Keriflex, which is makes your nail immediately look good. And so you have a nice appearance immediately. But you come back about once a month for every 5 months, and the Keriflex is reapplied while the laser is still working. Now, a laser procedure takes about 10 months to a year. Okay, that's one treatment. But over the next 10 months to a year, the new nail will grow in healthy, because any treatment to a fungal nail is working on the new nail coming in, not the present nail. So it takes about close to a year for a nail to grow out from the nail root, from the cuticle, all the way out. So during that time, we apply this Keriflex, it's a resin, and nail looks good. And after we have wonderful successes with this procedure. Now, of course, go ahead. You're about to say something.
How long does it take, this procedure? How long does it, like, you know, I come in, I have a fungus, am I done in a day, in a week, in a month, and immediately? What's the deal? Okay,
so the treatment is about 20, 25 minutes long. And then, like I said, you come in every month for 5 months, and after 5 months, it's a big improvement, and it's still continuing. The improvement's still continuing for an additional 5 months. So that's about the length of time it takes.
So if a person has such a fungus, which is pretty much also unsightly, right? I mean, I'm sure that if you have one, you don't want to, be seen on the beach too much, kind of like it's not good looking. Am I right or not?
Right. You're right. Most people like to bury their feet in the sand when they have something like this, or cover it with coats of nail polish. Right. It's highly contagious too. So that's the other thing. It's contagious to other toes and to other people.
And people know that. So you don't, you start having, you go to some neighbor's home or whatever it may be, a family, and everybody takes off their shoes and even their socks, and they play, and you don't want to be part of that game.
No.
So now we're going into the winter now. So, and you said 4 or 5 months. So a person who wants to be ready for the Memorial Day spring thing on Long Island or wherever it might be should start fixing that now. Is that kind of what you're saying?
Absolutely. That's a great time. That's absolutely a great time. Your feet and nails will look a lot better by the summertime if you start right now.
Of course, anybody having it should start fixing it anyway. It wouldn't matter when, you don't wait. But if you want to be ready, it's like with losing weight. You don't start at Easter to lose weight to be ready for the spring, beach. All right.
Well, people are going to start January 2nd for that, January 1st, and then probably by January 4th they won't be on their diet anymore.
Yeah, that's kind of right.
The other things, the other things that nail fungus can, other thing nail fungus can cause is ingrown toenails and infections. Now, if you're a diabetic and you have a fungal nail that becomes infected, it becomes a major problem. The infection can spread as a secondary infection, as a bacterial infection that can spread right into the bone, and that's how diabetics get into trouble. So it's not just purely cosmetic.
Right.
There's definitely a reason that you want to get rid of the fungus. It's not healthy. It doesn't belong there and can cause other problems.
Well, I'm glad you mentioned that because obviously, when we talk about infections, we usually talk about, a big, ugly yellow bus somewhere here. We say an infection, or we talk about a bronchitis or something like that. But we don't look at things such as a fungus or as a gum disease as a major infection doing the same damage than any other infection, because it doesn't matter. It gets mixed up in the blood. There it is, and it gets your immune system lowered. And next thing you know is the smallest little wind will get you the flu and blah, blah, blah. You'll feel tired, exhausted, because your body, who has the soldiers to fight infections, they're there. But a little bit like now, we're involved in, 3 wars in this country? How many wars can we open before we run out of soldiers, so to say, right? Same with an infection. So that's, I think, a very big reason why you want to get rid of such an infection if you have it.
Right, exactly.
Good.
I agree.
Well, wonderful. Very enlightening again.
Thank you.
There actually are ways to do things, and obviously laser has come to podiatry, so podiatry wasn't totally bypassed by technology. That's good to know.
Not at all. Not at all.
It's good to know. Bye, Dr. Wishnie.
Yeah. Bye-bye.